I'm a reader in Global Perspectives on Neurodevelopmental Disorders, and I will be chairing this session. I'll start with a couple of introductory slides, and I'll then introduce the full panel to you, and each of the panel will give a brief presentation, and we're then looking forward to questions. We'll start off with a couple of questions, but we're really looking forward to your questions as well. So please don't be shy and use the Q&A button to ask us any questions you would like to pose to the panel. You can pose general questions or you can pose them to specific speaker and panelists. But I'll first give a brief presentation to sort of set the context on why we think, and I think, that this is an important topic. This is a picture taken in Debre, Libanos, a beautiful mountain range, a couple of hours travel away from Addis Ababa in Ethiopia. I do a lot of my work in Ethiopia, and I've included the picture here to illustrate the research gap in autism research. The vast majority of what we know about autism, what it looks like, how to diagnose it, what interventions might help, what might cause it, is based on research in high-income countries. Most of the autism research is done in Europe, North America, and then some work in Australia, some work in Korea, increasing work from China, but not the whole world is represented in autism research. So we don't really know much about what autism looks like, what interventions might help in very low income settings. To illustrate that gap further, here is a world map of where in the world autism prevalence studies have been done. And this map is kept up to date by Spectrum News, the Spectrum News website. And all the blue dots are individual studies of prevalence. Now, of course, prevalence is only one topic in autism research, but I think it illustrates the issue more widely pretty well. You'll see lots of dots in Europe, lots of dots in North America, but very few dots elsewhere. So this means that what we know about autism, our picture of autism, is incomplete and quite possibly biased. And this is important because a lot of kids with autism and other developmental disabilities live in these low-income contexts. This was highlighted by a study published in 2018 by Awosanya and colleagues, and they looked at the global prevalence of a wider range of developmental disabilities, not autism in specific, because especially in countries where there is very little research, it is difficult to estimate that with any precision. But what they estimated is that out of all kids in the world, so over 8% of kids globally have some form of developmental disability. But 95% of these children live in low and middle income countries, in those countries where we hardly do any autism research. So we know very little, we know not enough of how to support these children. And now I focus on low and middle income countries, but even within high income countries, this gap is an issue. If you scrutinize the autism research papers and you look at the methods section, then often papers done in the UK, in the US, are done in urban populations, often in white families and in highly educated families. So more diverse communities are underrepresented in these studies. And this is a problem because autism may be underdiagnosed in some ethnic minorities, not necessarily in the same way in different ethnic minorities. For example, the recent study by Rosa Hoekstra published this year suggested that in England, Black children are more likely to be diagnosed with autism than white children, but Roman travelers are considerably less likely to be diagnosed with autism. So this matters, we need to think about this. There's also suggestions that ethnic minorities and families with low economic status report receiving lower quality healthcare. So even if they are diagnosed, their support may not be as good. And these ethnic minorities tend to be underrepresented in autism intervention research. So even when we do the studies in high income settings, those ethnic minorities are underrepresented. So we may not be able to support them in the way that they need. So My argument is that we need better representation of diverse populations to better understand and to respond to the needs of these underserved groups, both in low-income countries and in high-income countries. And I look forward to hearing the views from the panel. And we have quite a diverse panel today. And so the focus of this panel is to discuss how does the experience of autism vary between cultures, and why is it important to build in room for diversity within autism research, be that on a global scale or within the UK, to allow for more diversity within our populations in our UK studies. So I'll briefly introduce the panel names now, and then I'll give them each of them the floor to present their work before we go to the Q&A session. So our first speaker is Dr. Ceri Ellis, and she will be presenting a review of reviews considering autism in low and middle income countries. So not focusing on a specific country, but giving a more global perspective. Then we have Yulin Cheng, and she will be talking about her experience both of being autistic, but also living in Hong Kong. And the last panel member is Adejumoke Awosanya, and she will be talking about her research on stigma in Nigeria. A couple of practicalities. So please submit your questions using the Q&A button. If you are in the audience now, your camera and video is off, so we can't hear you or see you, so feel free to pick your nose, we can't see it. If you are slightly unsettled by the closed captions, you can turn them off or on using the CC button. And I'll now briefly introduce my own work, just to explain a bit better why I am chairing this session, before I give the floor to Ceri. So most of my work these days is on the African continent, mostly in Ethiopia. And a study we are doing at the moment is both in Ethiopia and in Kenya. And so for the past 10 years, I've been working with colleagues at Addis Ababa University to do the first set of studies on autism, but also other neurodevelopmental disorders in the Ethiopian context. And that work really focuses on, firstly, better understanding the perspectives of families and their unmet needs. So what is it like to be a family that has a child with autism? I should add, we mainly know about the caregivers' perspectives because the children that are seen, the kids that are diagnosed, are almost all minimally verbal and mostly have a quite severe intellectual disability. So it is very difficult in the Ethiopian context to get a first-person perspective. So most of what we know so far is based on perspectives from caregivers or from clinicians or other providers. And here is a quote from a mom with autism. You can't go a mom of a son with autism. You can't go anywhere. With whom do you leave your child? I'd never gone to a hairdresser or got time to comb my hair in the first few years that I learned about my child's autism. At last I was forced to shave my hair because it was so tangled. So some of our work focuses on what is the experience now, but then also how can we improve it? How can we better support families? So I work with local communities in Ethiopia, with clinicians, with researchers to try to develop culturally and contextually appropriate interventions and then evaluate these interventions. And I hope that ultimately that helps to close this gap so that we can build capacity for research and for services in Ethiopia and other countries so that we can improve service provision. And I hope that there's also scope for North-South learning so that sometimes the UK can learn from things that happen in Africa and can perhaps better support diverse families within the UK. So that's all about me. But really this panel is much broader than that. And I am really glad to have on the panel Dr. Ceri Ellis. So Ceri, the floor is yours.
Thank you. So I'm just going to share some slides with you. I hope everybody can see those. Okay. So thank you very much for the opportunity to contribute to today's panel session. So I'm going to be talking about a paper that I contributed to called Achieving Universal Healthcare Coverage for Young Children with Autism in Low and Middle Income countries, which was a review of reviews. Great, so this work was led by Gauri Divan, Vikram Patel and Jonathan Green, along with other colleagues working in autism and global health research from across the world. So the focus of this work came about through collaboration and an appreciation for the need to improve access to comprehensive and integrated services for autism, which is recognised as a public health priority, a human right, and is a priority for the global mental health agenda. Early recognition of autism has potential benefits of support for parental adaptation and psychoeducation, of course, along with appropriate early interventions for children. As Rosa mentioned, a lot of the early intervention research literature mostly stems from high income settings and high resource settings, with a focus on effective psychosocial interventions. And there are many barriers in how they can be applied to low resource settings, and how they can apply to scale as well. So just to kind of highlight some of these barriers, so a variety of barriers contribute to low levels of detection, diagnosis and evidence-based interventions for autism in low and middle income countries and low resource settings. Generally, governments spend tiny fractions of their healthcare budgets on mental health care, of which an even smaller fraction is devoted to child mental health and neurodevelopmental conditions, with much of this spending allocated to psychiatric hospitals. And just to caveat this point, in a lot of settings, autism, as well as in the UK, autism support is usually sits within a child mental health services. The number of mental health professionals in low income countries is very low, and the proportion is said to be around 2 per 100,000 people. Another barrier is the availability of autism specialists, even in well-resourced settings. So these are professionals such as speech and language therapists and autism specialists. There's also a detection gap, so the identification of autism in the community, and the care gap, which is the lack of services and support available to people. So of course, all of these issues are not standalone things. So the aim of this paper was to synthesize the evidence surrounding these barriers and putting it all together into a theory of change framework. So a theory of change framework is a recommended framework to address the needs of complex initiatives and aims to describe a model of action or practice to achieve a hypothesized goal, in this instance, universal healthcare coverage. So the theory of change we developed presents a pathway from the recognition of differences in children by their families to the access of evidence-based detection, diagnosis and interventions, all of which are scaffolded within an effective health system and policy framework. But I will explain this in a bit more detail later. So the review that we did, the review of reviews, aims to map the components for achieving this complex change over time. So how did we go about this? So as I mentioned, it was a review of reviews. And we used Ovid to conduct a database search. So you can see here the amount of papers that we reviewed in this Prisma flow diagram of the study selection process. So we started off with 3,000 odd papers, and through the different stages of synthesizing papers, we then included 33 in our final review. So just to highlight as well, the keyword searches that we use using Boolean syntax was keywords to do with autism, the age group which was specifically children in this case, the article type, which needed to be any kind of review, LAMIC context, which is a low or middle income country context, and then the pathways to care, such as identification of autism. And this is the final sort of theory of change that we came to in the end. So through segmenting the topics of the literature review, we first of all came up with 4 broad categories, which you can read about in much more detail in the paper, so I do suggest that you do that. So along with themes we identified from the different articles, so they were the social context of autism and family experience of a child with autism, including parenting stress during caregiving, socio-cultural influences, pathways to help seeking, community level awareness and associated stigma. We also looked at barriers to detection and diagnosis, including types of screening and diagnostic tools, low health worker awareness of autism, and other challenges impeding their appropriate use. We looked at access to appropriate evidence-based intervention at the level of the child and family, and the social policy and legislation with relevance to universal healthcare. So taking all those things together, we analysed all of the papers thematically for these topics, and you can read about more recommendations in the paper. But this theory of change incorporates several key progress elements to form interim outcomes supporting the vision of universal healthcare. So this is to access the key resources, so practical tools and workforce provision required to enable access to universal health coverage. The next one is accurate detection procedures, access to quality evidence-based interventions, and 4 further overarching themes which transcend all of these factors, which were community level services with increased demand for services, harnessing of technology, enabling policies, and high quality research. So the pathway to universal health coverage, though represented in our theory of change as a linear process, naturally in practice will require a whole host of complex processes to enhance interaction effects between its different components. So as well as combining interrelated elements and adapting to unique contextual influences, recognising that the ultimate goal here will need environmental modifications beyond healthcare, for example, to also apply to the education sector, but we didn't look at that. So thank you very much, and I will pass back to Rosa now.
Thank you very much, Ceri. And just to remind the listeners, so this is a paper, the first author is Gauri Divan. The paper was published earlier this year. It's a fantastic paper. I really recommend you read it. I'm learning a lot from it. So thank you, Ceri, for sharing that. We will now go on to the second panelist, and that is Yulin Cheng.
Thank you, Rosa. But I don't have any slides, so I'm just going to speak. Okay. Hi, I'm Yulin, and thank you, Autistica, for having me. It's my privilege to participate in this year's research festival alongside many distinguished speakers and allies of the autistic community. I'm doing my PhD study at the University of Hong Kong, and my research looks at the experiences of discrimination and stigma among autistic adults with intersecting minority identities and its impact on their outcomes and well-being. And it is a mixed methods bilingual study designed to capture a more diverse sample of participants from Hong Kong and internationally. As we know that the majority of autism research comes from Western developed nations and has been overrepresented by white participants. And I'm at the stage of recruiting an advisory group of autistic people to review the study, so I won't be able to report on any findings as yet. But I join in today's discussion from a lived experience perspective as an autistic person living in Hong Kong, and the challenges of doing neurodiversity research in Hong Kong. Like many elsewhere, the predominant framework that shapes autism research and narratives in Hong Kong is the deficit model. And I think a lot of us here would be familiar with the criticisms of the deficits model. So my research is similarly driven by the desire of many others here to reshape the narratives and hopefully to make positive changes to the lives of autistic people. And sitting here with everyone else, albeit virtually, most autistic people, wherever you come from, will be familiar with and relate to the experiences of stigma, discrimination, and ableism surrounding autism. And we've heard from different presentations throughout the week about the importance of looking beyond the diagnosis, engaging with the community, and integrating values of neurodiversity. And everyone is on the same page, and we are passionate about making a positive impact. But it's a different story when you are presenting to an audience who, for some reason, whether it's cultural difference or other reasons, they don't look at it the same way, or maybe they don't realize the privilege they have, or who are set and rigid about the way autism research should be done, or they're influenced by the negative stereotypes of autism. And sadly, a lot of times when we hear stories about autistic people, the stigma and discrimination are being perpetrated by well-meaning people or organizations claiming to be helping autistic people, but failing to recognize the harm that they are causing. I don't think my experience is unique in this respect. You can do autism research in any part of the world, and the challenge lies not in doing autism research per se, but doing neurodiversity research in an environment where the majority do not approach autism the same way you do, and perhaps have no interest in prioritizing the voices of the marginalized. And in the absence of a strong disability culture and autism advocacy, the challenges of trying to change the deficit narrative is very much compounded in such an environment. And we know that neurodiversity is a social movement facilitated by the internet, which has made it accessible to many autistic people. But its global impact is far less limited. Languages, culture, social-political climate, etc. These are some of the barriers limiting the impact of the neurodiversity movement. And we are not just talking about low and middle income countries here. As Rosa mentioned, even in high income countries like Hong Kong, there is huge disparity in services and support for autistic people and their families. And I consider myself an ethnic minority in the neurodiversity movement, considering that much of it is taking place online. And it wasn't until I embarked on my PhD study and with that privilege and background that I'm starting to broaden my connections here. And this and the fact that the pandemic has actually made neurodiversity more accessible, because I can now attend these autism-related conferences and events virtually. So being bilingual, that gives me the privilege of learning about the neurodiversity movement from the writings of other autistic people. But most people in Hong Kong, perhaps they communicate in Cantonese or Chinese, and there's not a lot of resources on autism, let alone neurodiversity. Conversely, as an autistic person, I think about to what extent is the international autistic community embracing of diverse culture and opinion within the autistic community? And how can we account for that disparity in resources and skills? And these are just some of the challenges I faced as an autistic student doing autism research in Hong Kong. So on the one hand, what the research I'm trying to do is about advocating for changes in the Hong Kong community. And on the other hand, it's also about communicating with the wider international autistic community about advocating for more diverse representation and global support for autistic people doing autism research in underrepresented countries. This is the end of my presentation. Thank you for listening.
Thank you so much, Yulin. What a beautiful call to action for all of us. Thank you for sharing. And I'd love to hear more when we get to the Q&A. Then we go to our third panel member, and that is Adejumoke Awosanya, who did her PhD studies on stigma in Nigeria.
Okay. Yeah, I'm just going to share the first slide of mine. Okay, so thank you, Rosa. Thank you to Autistica for this opportunity. I'm so grateful. Okay, so my work is on public attitudes towards autism in Nigeria, and I'm kind of looking at the role of awareness, knowledge, and other theoretical drivers of autism stigma. So my work is actually stirred out of the fact that there are a lot of gaps, like Rosa said, in autism research generally. And also there are tentative reports that there is low level of knowledge around autism in Nigeria and a high level of stigma towards autistic people, autistic individuals in Nigeria. And that was actually what stirred my work and wanted me to find out more about it. Also is the report around several factors influencing and instigating stigma, especially in Africa and in Nigeria. And most of this aspect has not actually been dealt with, especially when it comes to autism stigma. And that's personally what made me decide that, okay, I'm going to explore this field more and to actually get evidence and empirical reports on it. My research question is majorly around what are the attitudes, awareness, and knowledge levels that exist towards autism among Nigerians, the Nigerian general public, and what are the theoretical explanatory drivers of autism stigma in Nigeria. My research methodology was a cross-sectional quantitative survey, whereby I sampled participants from an urban area in Nigeria and a rural area in Nigeria, which is in Lagos and in Niger State. This is just to actually check if there is any variation within stigma in the urban area and in the rural area. I adopted a tool which we actually tested in the pilot study. From my findings, I realized that actually my study confirms or validates the previous report on autism stigma in Nigeria, in Africa and Nigeria in specific, and which is high levels of negative attitudes. Also, there are low levels of adequate knowledge amongst Nigerians, among the participants that I observed. I found out that 60% of study participants scored higher on the stigma score, with the rural participants scoring more higher than the urban participants. Then also I found out that urban participants scored higher on knowledge and awareness score. This is actually showing us that knowledge is actually a little bit more in the rural areas compared to the urban areas. And also it's showing us that rural participants might be a little bit slightly stigmatizing when it comes to stigma than the urban participants. Looking at my logistic regression, I found out that knowledge and awareness is only the one that predicts autism stigma. We realized that the higher the knowledge and awareness, the lower the autism stigma amongst participants. Also, my results also shows that age, geographical location, religion, and religiosity are significant predictors of knowledge and awareness. I realized that people that are more religious and subscribe to a particular form of religion tend to have lower levels of knowledge and awareness when it comes to autism in Nigeria. Generally, findings from my study indicates that eliminating autism stigma in this context requires strategies that are targeted at increasing knowledge, public knowledge and awareness. And also likewise, age, geographical location, religion, and religiosity needs to be considered and incorporated in any campaign strategies that we are doing in Nigeria in order to help increase awareness and knowledge in Nigeria. Currently, I'm looking at which specific knowledge gaps within the tool, so that this will help inform targeted campaigns, whereby we know which particular knowledge gaps are there within the Nigerian, within the tool itself. How did participants do well within the tool? What questions did they not really have much knowledge on? And this is presently what I'm looking at. The implication of my study is it would contribute, or it is contributing now, to more knowledge and understanding around autism stigma in Nigeria. and it represents a groundwork for further examination into the role of culture of autism stigma in Nigeria. Like I said earlier, my findings also validate the fact that there are actually unique socio-cultural drivers of autism stigma in Nigeria. And then my study recommends that an increase in autism stigma campaigns that are culturally sensitive and developed specifically to include some of these socio-cultural drivers that I've talked about. And we also recommend an increase in autism research in Nigeria generally, as there is a huge gap when it comes to autism research. My systematic scoping review highlighted that presently there are only 2 studies that are specifically targeted at autism research, specifically targeted at autism stigma research in Nigeria, which is quite small, looking at the big landmass that we have in Nigeria, and then we just have only 2 studies reporting on autism stigma research in Nigeria. This is actually something that the government should probably look into. I would like to thank my previous supervisors for their contributions, Dr. Yanis and Dr. Chris Papadopoulos. Thank you very much. And thank you, Rosa. I'm done with my presentation.
Thank you so much, Adejumoke, for sharing your interesting work in case that is not obvious to everyone in the audience, quite challenging circumstances. It is not easy to do this type of work in an African context, and you managed to collect quite a data set in what I'm sure wasn't easy. So well done.
Thank you.
Thank you all for your presentations. This brings us to the Q&A part of this panel. And so listeners, please, if you have any questions, pop them in the Q&A box. I'll start with a couple of questions we've prepared, but then please ask your own questions and we'll ask them to the panel. So just to kick off, can I ask all 3 of you to consider, can you tell me a bit about why you chose to study this particular topic? So what got you into this study, and what drives you? And I suggest I'll use the same order. So Ceri, can I start with you, please?
Sure. So I guess just starting with my own personal interest in becoming an autism researcher. So I have autistic family members, and at school I was very lucky to do lots of work experience in special schools, which kind of drew my interest into studying psychology at university, and learning more, kind of broad interests in language and communication as well. And then I started working with the Social Development Research Group in Manchester, I think about 5 years ago now, working on sort of pragmatic clinical trials of psychoeducation and psychosocial interventions for autistic children in and around Greater Manchester. But I guess I'll talk about that a little bit more when I come to answering some of the questions later on. But broadly, that's where I come from. And then through partnerships through our research group, made links with Gauri and a team who work in Goa and New Delhi. And I've been really lucky to learn loads about autism from the global perspective as well, so I'm very lucky.
Thank you for sharing that. And Yulin, I think we already know a bit about what drives you, but perhaps you can reflect on that a bit more, share a bit more on that, on why you are studying this particular topic.
Interestingly, it actually started with a report published by Autistica on suicide as a hidden crisis. I think it was the report that embarked me on this research into looking at the effects of discrimination that is perpetrated by this medical deficit model. Because I remember after reading that report, I went to look for all the research articles mentioned in that report to find out about suicidality in autism. And after reading all the articles, the is just very depressing, because all of the articles is just talking about deficits. Autistic people are prone to suicide because they are autistic, because they are impaired, and because they lack empathy, and these. And by the time I finished reading all the articles, I just felt like, well, it kind of explain why autistic people are at higher risk of mental health conditions and suicidality. So this really starts me into the journey of looking at the effects of discrimination and stigma on well-being. Yeah.
Excellent, thank you. Really important work. And Adejumoke, could you also share?
Okay, so my from the start, I already had this interest in mental health, but my love for autism started when I went to a conference in Nigeria, which was specifically targeted at stigma around autism in Nigeria. And then I came back to the UK, was talking to my supervisor around it, and then he sent me a bunch of journals on autism generally. And then I started reading into it, and then I started getting interest in it. And focusing on the Nigerian perspective or the African perspective, then I realized that there's a lot of stigma around autism in Nigeria, in Africa, and that was just it. I just wanted to learn more, wanted to know more about it, and that was the start of the journey.
Fantastic. And that perhaps links a bit to the second question that I'd like to pose to all of you, and that is that based on the work that you are doing or have done or are continuing to do, how do you think can the experience of autism differ across the world? Do you have any reflections on that, on how it may be different for autistic individuals, for families? Ceri, would you like to start off again?
Yeah, thank you. It's a really interesting question, and I'm really looking forward to seeing kind of our range of responses on this one. But I think because there are such a range of cultural and kind of socioeconomic factors at play, there's just such a huge range of experience kind of from the perspective of families with young children with autism in kind of understanding autism in their child, seeking a diagnosis, and the whole process around you know, how they are supported in that journey, kind of what evidence-based interventions are available to them, if any, and how the family as a whole is supported through the journey, and kind of post-diagnostically as well, what the journey is for that child kind of growing up as well, which I guess taps into more about knowing more about their identity and understanding their autism as well. So I think there's just such a range of perspectives within the kind of coming from that journey, how that can really differ across settings and depending on where you live and the kind of cultural background of which you live in as well.
Yes, thank you, Ceri. So both cultural background, but also socioeconomic contexts, all of these can shape the experience. Yeah, absolutely. Yulin, would you like to add to that?
Speaking from my personal experience as an autistic person, perhaps my experience is not necessarily unique, but I would say the difficulties are exacerbated by cultural values, lack of awareness of autism, lack of resources, support and advocacy for autistic people. And in New Zealand, the Maori word for autism is in their own time and space. And I couldn't agree more with that, because these are precisely what I need, but it's kind of considered a luxury. I need to do things, I need time to do things and to process stuff in my brain, but we really have the luxury of time living in a fast-paced city when you are expected to multitask and work under time pressures to prove that you are capable. But what really affects me is the sensory sensitivities with noise and crowd. And it's practically impossible to avoid that in Hong Kong. So I tend to avoid unnecessary trips and commutes where possible, but people don't really understand that. And they perceive your self-care behavior as a behavioral problem rather than a sensory one. So I guess that's another issue with conceptions of autism, which is still largely viewed as a behavioral problem that requires behavioral intervention. Yeah, that's pretty much my experience as an autistic person living in Hong Kong.
Yeah, you raise fascinating points that also sort of suggest how within a country this can still be dramatically different. I mean, I know Hong Kong is a city, but if you think about other countries where you have very big city life or very rural life, the experience might be dramatically different. And I've speculated about this, but I don't know the answer yet because we haven't studied it. If you take a country like Ethiopia, where I work, so we never see someone like you, Yulin, in the clinic. They do not, people like you do not come to clinical attention, and that is probably mostly because the lack of awareness and lack of services. So it is very difficult for me to have any idea of what that experience would be like. But I have wondered, would it make a dramatic difference if you lived in Addis Ababa, or you live in Hong Kong, or you live in the rural countryside of a place like Ethiopia, where life, you herd the cows or the sheep, you get up when the sun comes up, you eat twice a day, you go to bed when the sun goes down. So life is very stable from day to day. Challenging, you know, it's not an easy life, but it is relatively stable with not a lot of external influences like the ones you talked about. So the sensory sensitivity, I can imagine in that type of context would perhaps be much less prominent. So thank you for sharing how the added dimension of living in a very busy city and the consequences that it has for you. Adejumoke, would you like to add?
Yeah, I was just thinking that looking at it from the stigma perspective, I would say that living in Nigeria can be a little bit challenging because you can't even discuss it with people. You're not, talk about it is a shame. It's like a shame. That's the way the public has framed it, which is different from somebody living in probably the UK or is living in a bigger world, whereby it's easy for you to talk to somebody about it, about your concerns, you know. But places like where we go to undeveloped countries or countries that have this spirituality attached to everything, it's kind of a little bit different. The experiences are different. The stigma is higher because people don't even want to talk about these things. So I feel like the experiences for autistic individuals might be a little bit different.
But it also raises interesting questions because it's like I've heard like people from Western autistic people living in, say, in the Western developed countries, they move to another culture because in that different culture, their behavior will be seen as something that is not related to their autistic behavior, but rather to the cultural differences. So in that sense, even though they move to a country which has equally high stigma of autism, they kind of feel more accepted in that different culture. So that kinds of raise an interesting questions here.
So would you argue, or would you think that potentially stigma is less severe for recent immigrants or for migrants, for expats? Or did I misunderstand you, Yulin?
Yeah, I mean, what I was trying to say is we're talking about how stigma really affects autistic people. But at the same time, there are people moving, like, for example, from Western countries moving into, say, Japan or Asia, because they think that in a different culture, they are more acceptable. If they perform differently, they will attribute that to cultural differences instead of their being autistic. So in a way, even though the stigma still exists, they feel more at home, at ease in that different culture, if I'm making any sense here.
Yeah, you totally do. You, as a migrant, you feel different from others per definition, and then so your autistic being is one layer to you being different, rather than the fundamental layer of why you're different. Yeah,
yeah.
For that perspective. And if we then sort of take the lens to the UK and diversity in the UK, how do you think that might shape, so cultural differences within the UK, how might that shape the autism experience? And Ceri, would you like to comment on that?
Sure. Again, I sort of come at this from a researcher's perspective, working predominantly with families of autistic children who have been newly diagnosed with autism, sort of between the ages of 2 and 11. And within this, even within that age group, pupils have experience across not only kind of different cultural groups, but different socioeconomic groups as well, which kind of feeds into a kind of different cultural group in itself in the UK, is really varied. You know, Manchester and Greater Manchester in itself is a very varied geographical urban area, and within that there's lots of different pockets of cultures and backgrounds. And like Adejumoke said, there is kind of possibly less stigma here, but still in different groups and different groups of people, the kind of knowledge of autism varies quite a lot as well, and that has a big impact on what parents know about their child and how empowered they are to kind of advocate for their child through the services that they access to kind of get kind of either support or any kind of appropriate interventions that they may need for their child. And quite often it might take a few years for a child to struggle at school or to kind of fail in some way in the system, but people do get support in the UK. And I think there's difficulties with some people with accessing services, be that sort of if they use English as a second language and just aren't supported with translation services, which is one example, but also the kind of stigma and difficulty in accessing the services in the first place, and kind of knowing how to engage with health professionals about the information that they need to help their child, really. So I know that's kind of coming from a very kind of specific perspective, I guess, but just kind of anecdotally, yeah, really kind of varied experience, I think, from the families that have had the pleasure of working with.
Thank you for sharing that, and also to highlight comments that were made in the chat by some of our audience that I think is important to acknowledge, that stigma still is prevalent in places like the UK and Germany and other countries too. So what exactly you experience, some of the services might be more easily accessible here than in a place like Nigeria or Ethiopia, but it doesn't mean that there is full awareness and autistic people are fully accepted. At least in my experience, there is still a lot of stigma, and as Ceri said, potentially quite a long diagnostic journey until you get access to the services. Yulin, I know you are based in Hong Kong, but you lived in the UK at least for a while. Do you have any comments on how culture might shape the autistic experience within the UK?
I don't really know how to answer that, but it was in the UK that I actually started to learn a little bit more about autism. It's where I first heard of the term autism, and I think so. I guess in this way, education, the privilege of having an education in the UK, that kinds of gives me access to more resources about autism.
Excellent.
Yeah.
And Adejumoke?
Okay, yeah, just before I answer the question, I just wanted to quickly say something, because yes, there is, I would acknowledge the fact that there is stigma here in the UK, because there was a study that I carried on exploring the difference between stigma amongst English people here in the UK and Nigerians. I was trying to see the levels of stigma within these two. And the findings from my study showed that there's still a high amount of stigma even here in the UK, and there are also low levels of knowledge. The only difference between living in the UK and living in Nigeria is that you could talk about it. You know, at least you have an idea where to go for help. That's the difference. Now, in places like Nigeria, Africa, and generally, it's a little bit difficult for you to just come out and like talk about some of those things like that. So that's just what I was trying to point out from the beginning. Yeah.
Thank you. And I just wanted to add two comments that have come in the chat that I think are relevant for this discussion. Was someone raising that really, if you're part of the Chinese minority living in the UK, you experience a double discrimination, because it is not yet as widely accepted within the Chinese community and culture, so that can be really complex. So even though services may, at least in theory, be more easily accessible, you can still experience stigma. And then another interesting perspective suggesting that it really, even across Europe, it may really depend on where you live. So the perspective given that someone like Greta Thunberg could not have such a welcoming platform in Germany. And so it seems to be different in Sweden. And also they're suggesting that perhaps Spain is more welcoming. So even within Europe, where relatively speaking, the socioeconomic differences are not as big as if you would compare them on a global scale, and relatively speaking, the services are relatively well developed, although still with marginal differences, it might really make a difference of where you live. I soon want to go to questions from the audience, but I want to make sure that we cover how do we improve things, so that we don't just talk about, what all the difficulties is, but how can we make it better? How can we improve representation, global representation, diverse representation in autism research, and how can we improve the lives of everyone who is autistic rather than the white, highly educated? Ceri, do you want to start?
Sure, yeah, thank you. So I guess probably I'm coming at it at a kind of narrow lens of kind of as an early autism intervention researcher in the UK, and specifically within the kind of urban area of Manchester, but hopefully I'm kind of covering a few things that will be generally kind of relevant for research. I think Nicholas Chown as well in the Q&A has asked about how we kind of better engage ethnic minority communities in the UK in terms of research. So just kind of reflecting about how we develop our research studies and how we recruit participants into studies, and the pathway in which we kind of communicate kind of the different things that we can offer in our research. So I think things that, good practice, things like recruiting through health services like the NHS, different CAM services, or through local schools, where you're more likely to get engagement and you can explain your research on a kind of one-to-one basis to participants, which kind of breaks down barriers and the kind of stigma about research sometimes that there exists as well. Kind of things that we can do in terms of funding as well, in making sure that we apply for funding for things like translation services in grants, so that we can incorporate people that use different languages as their mother tongue in our research as well. And I think it's so important to include measures as outcomes in our studies that are kind of culturally appropriate as well. So making sure that we're not using very kind of specific assessments that target certain behaviours that just don't translate into other cultures. For example, kind of on the Vineland assessment, I think things ask about, can your child make themselves a snack, but that's might not be culturally appropriate for everyone, as an expectation of what your child is kind of expected to do. So I think just making sure that we're looking at things in a kind of critical lens and how we can be more kind of transparent in the way that we conduct research as well, and make sure that we're trying our best as researchers to kind of communicate to kind of people from different backgrounds, and making sure that we're kind of breaking down these barriers and doing things better.
Thank you. And Yulin, do you have thoughts on this?
Yeah, echoing what Ceri has said, I'm seeing more and more research employing international participants, so say global survey, and I think this is one way of trying to diversify your sample. But as someone mentioned in the chat as well, it's also about having those surveys translated into different languages so that you can access to people who don't speak English. And for my own research, I'm doing discrimination using an intersectional lens, and I think it's also important to incorporate intersectionality into a research. And one useful paper I found on intersectionality is that is a paper written by Ko, and she said there's 3 questions that researchers should always bear in mind when they are doing research. And I think these are helpful in trying to, as Ceri was saying about thinking critically and reflectively about the way we're doing research. And the 3 questions that Ko mentioned in the paper is that we have to always think about who is included within this category, what role does inequality play, and where are the similarities? And if we ask ourselves these 3 questions, and I mean, I know that it's impossible to recruit really a representative sample of autistic people because they are so diverse. But if we bear in mind these 3 questions and use these to guide our research, I think it's also one way to try to improve diverse representation in autism research.
Absolutely. And you referred earlier to the sort of positive challenge of COVID. I mean, COVID has, I think, negatively impacted all of us, but you refer to how it also has opened up possibilities. For example, you can attend this conference here now from Hong Kong. Do you see further possibilities like this? So are there ways how we can capitalize on this more remote working, more remote engagement that can help in increasing diversity?
I guess it's providing alternative hybrid options. It's always constantly being open-minded to different alternatives to doing things, and just trying to your best, whatever you can, to make an effort to reach out to people, and sometimes it takes time, but sometimes the people will come to you eventually. Say for my research, I did have a worry about reaching out to autistic people in Hong Kong because they are pretty much largely an invisible population, but you can still try to find them through some social media pages, and I believe that eventually when you do your research, slowly and hopefully when word gets out, the people will come to you as well. So.
Thank you. And Adejumoke, how do you think, how can we make things better?
Okay, I like I said, I think that one of the things that we can do, especially when it comes to ethnic minorities, is to try and increase the kind of the amount of research that comes out from talking about ethnic minorities, talking about research basically on Africa, the African context in itself, and trying as much as possible to, because presently there are less fundings when it comes to say for instance, Africa, Nigeria, there are less funding, and most research that come out from these regions are usually probably individual sponsored, and you have only a couple that are, you know, sponsored by the government or sponsored by institution, and which actually makes it a little bit, which kind of gives it a little bit of struggle. Because I remember when I was doing my own research, due to the fact that it was individual sponsored, there were a lot of things that I could have done if I had more funding that I wasn't able to do, you know, and that's one of the perks of it. So, you know, having more sponsorship when it comes to research would help. And also researchers being very open about the implications of their research. I think that's very, very important. You don't want to give people the perspective that, oh, when you do this research, you're going to get this at the end of the day, and then they don't end up getting it. For instance, in my context in Nigeria, when I was carrying out my research, you heard people saying that, oh, what am I going to get at the end of the day? Is there going to be a quick change, or are they suddenly going to be talking about autism more often and all that? And then as a researcher, you're tempted to like, okay, this is going to happen, just to get them to respond to your questionnaire and all that. But, you know, researchers have to just be as open as possible so that you can get the best result from participants. Yeah.
Excellent, thank you. And I also just wanted to reflect on you for a bit more. So Ceri gave some practical tips on how can we recruit more diverse populations within the UK, recruit via schools, recruit via clinics. Adejumoke, I'd be interested to hear your views. When I speak with my Ethiopian colleagues in the UK, they say, recruit via churches. That's the trusted member of society. That's where we hang out. Would that be so? And perhaps as a second reflection, at least for me, is also have people from the community you study on your research team, because the Adejumokes will know how to reach the Nigerians in the UK. The Rosas probably don't, but you do.
Okay, I remembered when I was doing my first study, when I was trying to recruit Nigerians. Yeah, I think one of the best places to get Nigerians are from churches. Nigerians are very spiritual people and religious people. So once their pastor says, go and fill the questionnaire, they tend to fill it. And that's what I was saying. You know, that's a way to kind of sensitize Nigerians. You know, go through the spiritual leaders, go through the religious leaders. You know, once they tell their members that do this, they kind of follow them. So if you want to get your research being done, if you want to involve Nigerians, Africans, you know, go to the churches. Yeah, you get them to fill it.
Excellent, thank you. And I am struggling with all the beautiful questions in the Q&A, but we are running out of time. I am suggesting that we grab one question that we haven't answered that each of you can give a perspective on to close this off. And then whilst you are talking, I'm going to share a slide with all your contact details on it so that people know how to contact you. So I thought if we have as the final question to reflect on, can you talk about the approach to interventions in various cultures? Are interventions mostly about changing behaviors, making them look more neurotypical, or do you also see acceptance and right-based approaches to working with autistic individuals? Ceri, can I start with you? And I'll share my screen with the slides in the meantime.
Sure, that's such a great question and really topical, I think, and links to what I was saying with my colleagues yesterday with Kathy, Lene and Martine, where in the UK, you know, we're hopefully moving away from a culture where interventions are seen as something, you know, within a kind of normative agenda or kind of, you know, for the purpose of curing autism, that sort of perspective, and more towards better understanding, you know, what we need to do to better support autistic people so they have more equitable access to kind of strategies and interventions that actually are beneficial, that actually don't cause harms, and kind of getting this message across is kind of hopefully moving forward and in the right direction. What's kind of positive to see as well is kind of research being done on, again within the context that I work in, with parents and psychoeducation, and kind of teaching parents and adults who work with autistic children, kind of giving them not only knowledge about autism, but explaining things from a neurodiversity perspective, which hopefully will help with kind of developing this, the way we need to go with the way that we look at interventions and what the purpose of interventions, what they do and what they're for, essentially.
Thank you for that. Yulin, do you have thoughts on this?
I'm recently doing a review of research publications on autism in Hong Kong, and there are actually quite a lot of research into interventions, but most of these interventions are targeted at autistic children, and we know very little about autistic adults in Hong Kong. They're practically invisible, like I said earlier, and it's very much focused on autistic children and their parents. And when we talk about interventions, and sadly as well, a lot of them is aimed at trying to making them less autistic. So there were some practical skills such as teaching them to brush their teeth, etc. But a lot of these, a lot of them are about teaching social skills, which I think kind of Chinese culture put a lot of emphasis on training and building on social skills. So there's a lot of intervention on that. Yeah, but pretty much it's very it's based on trying to make that person appear less autistic.
Thank you. So still quite a lot to be done. Adejumoke.
Yeah, I think I agree with what Yulin said. As I feel like there's still a lot more that needs to be done, especially, for instance, in the Nigerian context, where generally we have a lot of behavioral differences when it comes to autistic individuals, autistic children. And I feel like using a much more culturally effective tool to actually diagnosing these children might be much more relevant than just adopting different tools from different contexts. And that's because there are behavioral differences when it comes to autistic children, especially when it comes to cultures. There are different traits that you see in autistic children. And it might be very, very important for us to get to a station whereby we start developing culturally specific tools to, get children more diagnosed. Yes.
Thank you for that. Thank you. And thank you, all three of you, for your really insightful and fascinating contributions. So I hope everyone can see this slide. I do apologize if we didn't get to your question. We should have started with Q&A from the audience earlier. I am sorry. If you have questions for particular panel members, they were happy to share their email addresses, so please find them here. And the paper that Ceri talked about, I've linked to at the bottom. So the first author is Gauri Divan, with the link to the paper there. Thank you all so much for this fascinating discussion. To the audience, please know that there is a 5th day of the Autistica Research Festival. So do attend sessions tomorrow as well. And thank you all very much for your attention and attending today.